Now let's turn to Inria's electromechanical heart model. Inria's modeling work has been focused around developing personalized heart models around electronic, physical, mechanical, and biological properties, which can also be used to test hypotheses on the heart function. Now Tommaso Manzi will explain the nature of electromechanical heart models and what Healthy Child has done to turn very accurate generic models into personalizable models for the clinical environment.
Electromechanical modeling of the heart has been the subject of intense research since a long time now. From the very first work of Dennis Nobel and Peter Hunter in the 60s to the more recent work by Maxime Sermezan and Nick Smith and so on. So far the idea was to try to model all the physical, electrophysical and biomechanics phenomena that occur in the heart to be as accurate as possible to test some hypotheses on the cardiac function. The problem of this for the clinical applications is that these models are generic, but ultra accurate. Now the research is, okay, we have these models, let's try to apply them to the clinics and use these models to better evaluate the cardiac function of a patient and try to predict the effect of therapies and plan them. So the idea in Healthy Child was to take an electromechanical model of the heart, which has been simplified for these kind of applications, apply it for tetralogy of Fallot, this means adapt it for the pathology specificities, personalize the model for a given patient, and try to simulate the pulmonary valve replacement, as you may have seen at the demo booth there.
You will have heard Tommaso Manzi speak of the clinical applicability of the models. We will soon come back to this issue, but for now let's stick to looking at how the models are developed and the tools which are used in conjunction with them. As this slide shows, there are 4 parts of the electromechanical models which are necessary variables for the model to be clinically usable. The first feature deals with anatomy. The shape of the heart is taken from the models that were developed by Siemens, which we just looked at. But the anatomy is not just the shape. We also need the fibers. It means the preferred direction of contraction and wave propagation of the heart muscles. And this information is very hard to get in vivo. So we used atlases, which are computational models, which were already available. The second feature deals with electrical wave propagation. This is the trigger of the cardiac function. And we have simulated this based on the pathologies we were looking at. The third feature deals with the contraction of the heart. We used biomechanical models which simulated how the myofibers contract when they are excited by the electrical wave. A problem with these first 3 steps is that there are many different models which vary depending on their accuracy and the degree to which we can personalize them. For Healthy Child, we used the simpler models because they were more easily personalized by clinically meaningful factors, which we were able to get non-invasively. The fourth feature deals with boundary conditions. We needed to simulate the cardiac phases, put some pressure in the arteries, and due to our focus on the blue baby syndrome, the tetralogy of Fallot, we had to simulate the regurgitations. Inria has also developed 2 more applications. CardioVis 3D, which is dedicated to the visualization and processing of 4D medical data, and especially cardiac imaging and simulation data, and SOFA, a surgery simulation tool available to Healthy Child clinicians. It is important to note that these tools were not developed using European Commission funding, but they are publicly available and add some useful tools to the platform. CardioVis is the tool that clinicians are using to make the 3-dimensional plus time, which becomes in fact 4-dimensional, 4D, personalized heart models. The models that are produced are fully biometrically, anatomically, and electrically personalized and can be used to simulate a theorized surgical intervention such as the repair of a tear in the right ventricle. The tool will also be able to provide the clinician with a theoretical model of the blood flow through the ventricle following the procedure, a tool that is especially useful for patients with baby blue syndrome. Personalized simulation results can also be obtained, and healthy child clinicians can also simulate electric front propagation pressure and strain. These, of course, are all things which would be quite difficult to get in vivo. The other application is SOFA. SOFA is an open source framework primarily targeted at real-time simulation with an emphasis on medical simulation. Let's listen to Tommaso Manzi explain and demonstrate SOFA.
So the idea is that you take this model that we have just simulated and personalized, you put it in a virtual body, and then you do the simulation of the surgery. You replace the valve and you redo the remodeling of the right ventricle. So you cut what is extra or lesional and you close. So the heart is here. So this is another view of the system, just to show you the heart is well inside. And this is the pipeline. So you take your original meshes with the fibers. You cut all the myocardium you don't want anymore, the lesions, scars, fibrosis, and so on. You close with the system, and then you remesh. But since you are doing surgery, you must put some scars, because unfortunately when you do surgery, you have a scar that appears. And this is very important, because when you have a scar in the heart, this means that the contractility is affected and electrophysiology is affected also. And so this is a short movie of the operation, just to give you a teaser of what you can see there. So basically, you see nothing. So here we have cut the mesh. Now you can close it slowly, smoothly. And when you are happy, you stop, you save the mesh, and you have done the surgery. Of course, you have to take care about the fiber of the myocardium. They must follow the deformation. Everything must be consistent, and the software takes care of it. Okay. Now that you have a new mesh, a new anatomy after surgery, you can just redo the simulation. Here we are interested in just after the surgery, no remodeling, no long-term effect. We just look just after the surgery, so we don't change the parameters of the model, and we rerun the simulation. So you can see in the post-op the effect of the scar. The myocardium is not contracting anymore, and there is no electrophysiology because we have just said so, but we can change that if we want.
In this part of the Healthy Child story, we wanted to present some of the Healthy Child tools in a technical framework. In the next part, we will look at the clinical achievements and how clinicians are putting these tools to work.